Now coming to the second point of the lecture, which is the interpretation of waveform. Here you have 3 positive waves and 2 negative waves. The positive waves are A wave, C wave and V wave, and 2 negative waves, which is the X wave and the Y wave. Now coming to the waveform with relation to the QRS complex and systole and diastole. A is atrial contraction, which correlates with the P wave. After the P wave, there is a slight delay which shows in the CVP as an atrial contraction, and it is a diastolic event. Next comes the C wave, which happens with the ventricular contraction, that is after the QRS complex, and this is a systolic event. Next is the venous filling, which again happens in the systole. Here the volume comes into the right atrium. And X descent is when the atrial relaxes but there is ventricular systole. Finally, the Y descent, which again is due to ventricular diastole. So, 2 waves occurs in the diastole, atrial contraction A wave and Y descent occurs in the ventricular diastole. Your C wave, V wave and X descent happens in ventricular systole. Now coming to each waveform. The first wave is the atrial contraction. The first wave, which is the main wave of the CVP. Atrial contracts and you can see the A wave appearing here. That is the first one. Second positive wave is the C wave. Here the ventricle contracts and this contraction of the ventricle is reflected back on the tricuspid valve, which is seen as a positive C wave. That is C wave. That is the second positive wave. Next comes the atrial relaxation. That is the X wave, which again happens in ventricular contraction, but your atria is relaxed. That is X wave. The fourth wave is the venous filling. Here you can see the volume coming to the atria. Although the atria is relaxed, the volume in the atria is increased. That is the V wave. And finally, Y wave is the tricuspid valve opening and the blood from the atria goes into the ventricle, but the ventricle is still relaxed. That is the Y descent.